Hello, and welcome to the module Methicillin-resistant Staphylococcus aureus Basics, a Frontline Forces training presented by Superior Health Quality Alliance, or Superior Health. This learning module was developed for direct caregivers working in multiple healthcare settings who care for a variety of patients. It is also relevant for family members caring for a loved one in the home. Direct caregivers play a very critical role in providing care to individuals in many settings of care. Why? Because direct caregivers spend a great deal of time with their patients, which helps them to know and better understand the needs of these individuals. The purpose of this course is to further your learning and build on your current knowledge about methicillin-resistant Staphylococcus aureus, or MRSA. What you know and how you use that information improves the quality and safety of the patients you care for. This learning module, Methicillin-resistant Staphylococcus aureus Basics, is part of a series of modules exploring MRSA. You are viewing the first of two modules in the series, which provides a general overview about MRSA. The second module is for licensed staff and focuses on MRSA risk assessments and additional prevention strategies. It is not necessary to complete the entire series of modules in one sitting. You can leave and return to any of the modules at any time. Once you have completed this learning module, you may test your knowledge and understanding of the material by completing the quiz. Following completion of this module, you should be able to describe the prevalence of methicillin-resistant Staphylococcus aureus, identify MRSA signs and symptoms, describe how MRSA is spread, and identify who is most at risk for MRSA. Different varieties of Staphylococcus aureus bacteria, commonly called staph, exist. Staph bacteria are normally found on the skin or in the nose of about 1/3 of the population. The bacteria are generally harmless unless they enter the body through a cut or other wound, and even then, they usually only cause minor skin problems in healthy people. MRSA is a variety of staph that is resistant to many antibiotics. According to the Centers for Disease Control and Prevention, around 5% of the population chronically carries the type of staph bacteria known as MRSA. Studies show that about 2 in every 100 people carry MRSA. Although many people carry the bacteria in their nose, it can also be found in other places. Nearly 120,000 Staphylococcus aureus bloodstream infections and 20,000 associated deaths occur in the United States, according to a 2019 report. After years of progress and seeing a decline in MRSA bloodstream infections, it is now apparent that bloodstream infections caused by methicillin-susceptible S. aureus are increasing slightly in the community, approximately 3.9% annually. MRSA is a result of decades of often unnecessary antibiotic use. For years, antibiotics have been prescribed for colds, flu, and other viral infections that don't respond to these drugs. Even when antibiotics are used appropriately, they contribute to the rise of drug-resistant bacteria because they don't destroy every germ they target. Bacteria are constantly changing, so germs that survive treatment with one antibiotic soon learn to resist others. The resistive nature of MRSA lends itself to complications and greater difficulty finding helpful treatment options. Treatment difficulty allows the infections to spread and sometimes become life-threatening. The symptoms of MRSA can vary. For skin infections, a person may notice a bump or open area on the skin that is swollen, warm, inflamed, painful, full of pus, and they may also have a fever. Signs of infection other than skin, for example, lung infections or bloodstream infections, may include high fever, chills, confusion, dizziness, and aches and pains. MRSA infections may affect your bloodstream, lungs, heart, bones, and/or joints. It can then lead to internal infections, including pneumonia, osteomyelitis, an infection of the bone and bone marrow, lung abscess infections, endocarditis, which is inflammation of the heart's inner lining, or sepsis, an infection in the blood. An individual can be colonized with MRSA, meaning they have the organism normally present in or on the body, even though they don't have signs of illness. This individual may be contagious for an indefinite period of time. In addition, MRSA organisms can remain on some surfaces for about 2 to 6 months if they are not washed or sterilized. For most staph infections, including MRSA, the incubation period, the period between exposure to an infection and the appearance of the first symptoms, is often indefinite if the organisms are colonizing an individual. However, the incubation period for MRSA often ranges from 1 to 10 days if it enters broken skin or damaged mucous membranes. People who have MRSA germs on their skin or who are infected with MRSA may be able to spread the germ to other people. People who are colonized with MRSA are far less likely to spread the organisms to others. Spreading the germ is more likely if the patient is infected with MRSA. For a person to become infected, MRSA usually needs to have an opening in the skin, which could be an abrasion, cut, rash, or puncture. MRSA in the community is spread from person to person by direct contact. In addition, indirect contact is also a means of spread because, as previously mentioned, the bacteria can survive on surfaces for a long time. The spread of MRSA in a healthcare setting can be spread directly from unclean hands of healthcare workers or visitors, or by coming into contact with contaminated bed linens, bed rails, and medical equipment. It may also spread by blood, saliva, and/or droplets in the air that can land on people's skin or other surfaces. There are a few notable factors that put people at particular risk for MRSA. These include being hospitalized. MRSA remains a concern in hospitals where it can attack those most vulnerable, such as older adults and people with weakened immune systems. Having an invasive medical device. Medical tubing, such as intravenous lines or urinary catheters, can provide a way for MRSA to travel into your body. Residing in a long-term care facility. MRSA is prevalent in nursing homes. Carriers of MRSA have the ability to spread it, even if they're not sick themselves. Effective prevention of MRSA requires the following strict precautions. Always use personal protective equipment, such as gloves, gown, or mask, when appropriate. Always remove PPE before leaving the resident's room. Perform hand hygiene after PPE removal. Use dedicated patient care equipment, such as blood pressure cuffs or stethoscopes, and single-use disposable items, such as single-patient digital thermometers, whenever possible. If common use of equipment for multiple patients is unavoidable, clean and disinfect such equipment before use on another patient. And ensure adequate environmental cleaning of both high-touch surfaces and soft surfaces. Reporting a change in condition is an essential component of prevention and/or prompt treatment for any infection. The following changes in condition require immediate notification to licensed staff. Any symptom, sign, or apparent discomfort that is acute or sudden in onset, and a marked change, such as something more severe, in relation to usual symptoms and signs, or unrelieved by measures already prescribed. Congratulations, you have successfully completed this module. It is now time to test your knowledge by taking the quiz. Click on the link for the title, Methicillin-resistant Staphylococcus aureus, MRSA Basics quiz on the Frontline Forces webpage or in the YouTube description below.